Does that time of the month feel like a nightmare? Cramps, back pain, mood swings, sometimes even painkillers don't seem to work. Is period pain something you just have to endure? In traditional Chinese medicine, period pain isn't just normal, it's your body sending a distress signal. Today, we'll dive into the real causes behind menstrual pain from a TCM perspective and explore natural ways to relieve it. Stick around until the end because I'll be sharing a simple yet effective self-care tip to make your periods much easier. And if you haven't subscribed yet, now's the time. Hit that subscribe button and let's take care of your health with TCM. Period pain might not seem like a big deal at first, but for many women, it can be absolutely unbearable. It's often thought that period cramps mainly affect younger women, and some studies suggest that the pain might improve with age or after childbirth. However, in reality, many women in their 40s still struggle with severe menstrual pain. Today, we're focusing on a specific type of period pain, one that isn't caused by medical conditions like fibroids or pelvic diseases. Some women experience painful periods due to underlying health issues, but that's not our topic today. Instead, we're talking about common menstrual cramps that happen even when medical tests show no clear problem. However, there's one condition we need to mention: adenomyosis. About 1 in 4 women with adenomyosis experience intense period pain. In these cases, the pain doesn't just start when menstruation begins, it can start about a week before, get worse as the period arrives, and only gradually ease off after it ends. In fact, some women with adenomyosis begin feeling pain as early as 10 days before their period. The pain continues through their period and may even last for several days afterward. For example, while most women's periods last about 5 or 6 days, those with adenomyosis might have periods that last 7 to 10 days, and their pain can stretch several more days beyond that. This means that for some women, period-related pain can last up to 17 or 18 days each month. Imagine spending 2/3 of the month dealing with abdominal pain. This can be incredibly exhausting and even lead to feelings of despair. For most women, menstrual cramps mainly cause lower belly pain that starts a few days before their period and fades by the 2nd or 3rd day of bleeding. This is the most common pattern. However, period pain doesn't always come alone. Some women also get headaches, which get worse during their period. Others feel breast tenderness, a heavy or swollen sensation in the chest. Some experience cold sweats, nausea, vomiting, or diarrhea. In some cases, there's even a deep, cold aching pain in the lower belly, which can feel especially uncomfortable. In general, period pain presents with these common symptoms. It's important to note that period pain is mainly caused by uterine pain or abdominal pain. In Chinese medicine, the liver is often involved in this condition. The liver meridian passes through the lower abdomen, and when there is stagnation or blockage in the liver qi, pain can result. The pain is largely associated with the liver. Of course, it is also related to the kidneys. Since the main symptom is pain, we can apply Chinese medicine principles to analyze the condition. In TCM, pain is often described as arising from either blockage or nourishment deficiency. When the flow of qi and blood is blocked, pain occurs. When there is insufficient nourishment, often due to blood deficiency, pain also arises. So, what are the differences between these two types of pain? When there is qi stagnation and blood stasis, the pain is often distending or stabbing. In cases of blood deficiency, the pain tends to be more dull and less intense. This allows us to distinguish between the two types. Blockage-related pain is typically much more severe than nourishment deficiency-related pain, which tends to be mild. Now that we understand the basic symptoms, we know that the primary symptom of period pain is premenstrual abdominal pain. Some women may feel pain 3 or 4 days before menstruation, while others may feel pain just 1 day before. The pain can continue on the first day of menstruation, but usually diminishes significantly by the 2nd day or even disappears completely. Clinically, it is often said that if the pain lasts less than 3 days, it typically does not require treatment. However, if the pain is severe, treatment may still be necessary. But regardless of whether the pain is mild or severe, if it lasts longer than 3 days, treatment is necessary. Apart from the main symptom, period pain often comes with additional symptoms such as headaches, breast pain, cold sweats, nausea, vomiting, abdominal pain, or diarrhea. Some women may also experience cold pain. When treating period pain, it is important to adjust treatment according to these accompanying symptoms. From a pathophysiological perspective, some women's period pain is caused by blockages in the flow of qi and blood, leading to more intense pain, which is usually distending or stabbing in nature. Other women's pain is due to blood deficiency, which results in a less intense, more dull pain. Women with blood deficiency may also feel a sensation of heaviness in the lower back. From a diagnostic standpoint, period pain is primarily related to the liver and kidneys. So, how do we treat it? The treatment should focus on the underlying condition, either blood deficiency or qi stagnation and blood stasis. Therefore, it's not hard to understand that the first step is to nourish the blood and promote blood circulation. To nourish the blood and promote circulation, we can use a traditional Chinese herbal formula called Wu Tang for substance decoction, which consists of prepared Rehmannia, angelica root, white peony root, and ligusticum. This formula is widely used for women's health issues and is often referred to as the most important formula for women. It is used to nourish blood and promote circulation. What else should we do? Since the pain usually begins around menstruation, we need to regulate menstruation. A commonly used herb to regulate menstruation is Mu Cao Motherwort. Just from the name, you can tell that it's a herb meant to support women. The herb is particularly known for its ability to regulate the menstrual cycle, and we use it to regulate menstruation. Finally, since period pain is related to both the liver and kidneys, we need to focus on soothing the liver and regulating qi. In my previous discussion, I mentioned 2 herbs that are essential for treating female health problems, especially in gynecology: Xiang Fu Cyperus and Wu Yao Lindera. These herbs are effective for regulating the liver and relieving qi stagnation, and they are commonly used in formulas for treating women's disorders. Now we have the herbs for nourishing the blood and promoting circulation, soothing the liver and regulating qi, and regulating menstruation. However, the most prominent symptom of this condition is pain, so we must also include pain-relieving herbs. Many women who suffer from period pain have used pain-relieving medications like Yuanhu Tong Piana, traditional Chinese herbal remedy for pain. Yuanhu, the main herb in this formula, is an excellent remedy for pain. With this, we've addressed the stagnation of qi by soothing the liver and regulating qi. We've activated the blood and cleared blood stasis, and we've nourished the blood where needed. Since this formula both nourishes and invigorates blood, it addresses all these aspects. Next, we add a menstrual regulating herb, Mu Cao Motherwort, and another herb for soothing the liver and regulating qi. Now we have a formula that addresses qi stagnation, blood stasis, and pain. This combination of herbs is the basic formula for treating period pain.
How do we use it? The typical dosage is as follows. Shu Di Huang prepared Rehmannia 10 gram to 15 gram. Dangi Angelica 9 gram to 12 gram, Bai Shao White Peony Root 10 gram to 15 gram, Chuan Zhong Ligusticum 6 gram to 9 gram, for Mu Cao Motherwort, the dosage is generally 10 gram to 15 gram, for Xiang Fu Cyperus 10 gram to 15 gram, Wu Yao Lindera 10 gram to 15 gram, and Yuanhu 9 gram to 12 gram. With these 8 herbs, we have the basic formula for treating period pain. Now, this basic formula addresses the core issue for most cases of period pain, but there are still some individuals who present with additional symptoms. If the patient also has headaches along with period pain, we can add an herb called Monjingzi Vitex. Just 6 gram to 12 gram of this herb is sufficient. If the patient experiences breast fullness or tenderness, which is common in women with period pain during menstruation, I have mentioned 2 herbs that are effective in treating this condition in the context of mastopathy, Seojiaosi boxthorn and Segaluolafa. Both can be used at a dosage of 10 gram. If the patient is suffering from cold sweats, indicating severe pain, we can add Huangqi astragalus. Huangqi has the dual functions of tonifying qi and stopping sweat. We can use Z Huangqi prepared astragalus at a dosage of 15 gram to 30 gram. If the patient also experiences nausea, vomiting, or diarrhea, indicating digestive symptoms, we recognize that the spleen and stomach are involved. Since the digestive system is affected, we can add herbs that help regulate the spleen and stomach. For example, we can add Z Superilla, which is great for regulating qi and calming nausea and vomiting. If diarrhea is also present, we can use Chao Baiju aged white atractalodes. For Zisu, the dosage is 6 gram to 9 gram, and for Chao Bai Ju, 9 gram to 12 gram. If the patient experiences a cold pain sensation, meaning the lower abdomen feels cold, we can add 2 herbs to the basic formula. The cold pain is usually caused by yang deficiency, so we need to warm the yang. For this, we can use Rugi cinnamon and Ai mugwort. Rugi cinnamon is well known for its warming properties. This is the same cinnamon used in cooking. For Ai, the mugwort used for this purpose is typically roasted. These 2 herbs are warming in nature. The dosage for Rugi is 6 gram. And for Jiao Ai roasted mugwort, it's also about 6 gram. These herbs help warm the lower abdomen, which is often referred to as warming the womb. Of course, some patients may report that the pain is not just in the lower abdomen but also accompanied by a feeling of heaviness in the lower back, as if the back is falling. If the patient complains of significant discomfort in the lower back, we can add herbs to strengthen the kidneys and lower back. We will discuss herbs that strengthen the back later, but one common herb for this issue is Duzhong Eukamia. The recommended dosage is 9 gram to 12 gram of Chao Duzhong roasted Eukamia.
How should these herbs be taken? It's absolutely essential to understand the proper method of consumption and the timing of taking them. We often see this situation in clinical practice. A patient comes in and says, "Doctor, every time my period comes, I experience severe abdominal pain." Then you ask, "When was the last time your period came?" And they reply, "It just finished yesterday." You might wonder, if your period just ended yesterday and you're not in pain now, why are you coming to see the doctor today? This is an example that demonstrates how period pain medications have their own specific timing for when to take them. It's important to understand a simple principle. For example, women have a physiological cycle. As we discussed earlier, a woman's menstrual cycle typically lasts 28 days. During this cycle, there are changes in her body's yin and yang. If you divide the cycle into 4 phases of 7 days each, the body's physiological state is slightly different during each of these periods. So regulating a woman's menstrual health isn't something that can be done casually. It's not just about taking medicine when it's convenient or when you remember. Some other doctors might prescribe medication just because you walk in and ask, but I wouldn't do that. When women come to me for menstrual regulation, the first thing I do is figure out their cycle. Once the cycle is clear, I tailor the treatment to each of the 4 phases of their cycle. For period pain patients, it's not just about taking the medicine when the period ends. It's not about taking medicine randomly, like remembering to take it a week or 10 days later. That's not how it works. Generally speaking, for patients with period pain, the herbs should be taken 1 week before the period begins. For example, if menstruation is expected to start on the 7th of the month, you should start taking medicine around the 1st or 2nd, ideally 5 to 7 days before the period starts. You continue taking the herbs through the first few days of menstruation. That's 1 full cycle of treatment. Once the next menstrual cycle comes, you repeat the process. Usually with 2 to 3 cycles, most cases of period pain can be completely alleviated. Some more complicated or persistent cases may require 3 to 4 cycles, but generally 2 to 3 cycles will solve the problem. This isn't something you can just do randomly. It's not about taking the medicine when you remember or when you feel like it. There is a method to it, and it must be followed properly. In addition, lifestyle matters. You need to be mindful of your daily habits. For example, menstruation is closely related to the liver, right? The liver thrives on smooth flow and hates stagnation. Many women with period pain often find their symptoms are linked to their emotional state, so it's crucial not to get angry. Make an effort to stay positive. During the week before, during, and after your period, you should avoid getting angry. That's a total of 21 days a month where you must strive not to lose your temper, especially during your menstrual period, which is 1 week long. You absolutely cannot allow yourself to get angry. So ladies, don't get angry. And to the men out there, if you truly care about the women in your life, don't make them angry. When you provoke them, you end up dealing with their menstrual pain and mood swings. Don't blame them for the pain, it's your fault. Women are meant to be cherished, loved, and cared for. They are not meant to be upset or mistreated. Women are like water. If you treat them well, they will treat you well in return. Secondly, a woman may not have done anything particularly strenuous at home, but the truth is, women do a lot of small, tedious tasks that may seem insignificant to others but are quite labor-intensive, such as scrubbing pots, washing dishes, laundry, and mopping floors. In these processes, it's important to note that no matter what the season, spring, summer, fall, or winter, you should always wash clothes, pots, and dishes with warm water, not cold water. Some women might say, it's fine, I'm not having any problems. It may be fine today, but who knows about tomorrow or the day after, right? When the weather is hot and the temperature reaches 40 C, you might feel tempted to wash with cold water, thinking it will be refreshing. However, the temporary cooling sensation may lead to long-term discomfort. Even in the summer, when washing clothes or dishes, make sure to collect the water and let it sit for a bit, even just on your balcony. Let it adjust to the surrounding temperature. Don't use cold water. This is the second thing to keep in mind. Thirdly, it's crucial to control what you eat, especially cold food and drinks. Overindulging in cold foods not only harms the spleen yang, but also the kidney yang, which is the foundation of all yang energy in the body. Excessive consumption of cold food can weaken yang energy, leading to yang deficiency and cold, which may cause coldness in the lower abdomen, resulting in a cold uterus. We often hear women say, the doctor says I have a cold uterus. If you know this, yet cannot control your cravings for ice cream or cold watermelon from the fridge, the problem persists. Even though you may feel fine now or are still young, with time and age, you'll begin to feel the consequences. You may not be told by anyone, but you'll naturally start avoiding cold food yourself. Women should be especially mindful of this. Unlike men, women should take extra care to avoid cold drinks. This is a key aspect of self-care that we must pay attention to in our daily lives. Now, we've discussed period pain, primarily characterized by premenstrual abdominal pain, which may be accompanied by a variety of other symptoms. We've also shared a basic formula for treating period pain, with adjustments made depending on the additional symptoms. As I always emphasize, if you experience period pain, it's important to first go to the hospital for a checkup to rule out pelvic diseases or other organic problems. If the pain isn't caused by organic conditions, then we are dealing with primary period pain or secondary period pain, as we've talked about today. Of course, from treatment to medication and lifestyle changes, we've covered everything comprehensively. A holistic approach to care is the key to a satisfactory outcome. That's all for today's lesson. See you next time.